This week on Checkpoint, medical circumcisions gone wrong.
Mama ke khone go rota. Ke ga khone go rota a sokola go rota and then ne go ile mo pele ntse bandeshitswe.
Dula mpotsa go itsubi ka eletse why mama o nong sainela why o nong kisa mo
se ka re nka intse ke lahle o ba nne kutlile bohloko.
Parents want answers.
It's hurting as a parent thinking hore ke nna a signed that consent form or ngwana a ya lo circumcise kanti di results di tlo ba so.
This is Checkpoint and I'm Nkepile Mabuse. In 2013, former Health Minister Dr. Aaron Motsoaledi launched a nationwide medical male circumcision campaign as part of the Health Department's HIV and AIDS prevention program. Studies have shown that medical male circumcision can reduce the chance of contracting HIV by 60%. But circumcision is considered risky for boys under 14. Ditlhare Busiu and cameraman Tshepo Dlamini investigate botched circumcisions involving 10 to 12-year-olds in the Sedibeng District.
Not wanting her son to be an initiation school statistic, Puleng Putwane from Bipatong in the Val allowed her 10-year-old son, Tshepo, not his real name, to get medically circumcised. She heard about the procedure when Viyelizizwe Solutions, an NGO that offers male circumcision, advertised their services at Tshepo's school. He brought home a consent form.
The sign form here e o tshwantse we sign ya o dumella hore ngwana a ye a lo etsa for circumcision.
In the March school holidays, Tshepo and other schoolboys were taken by Viyelizizwe staff to the Levi Mbata Community Health Center to be circumcised. 12-year-old Thabo, also not his real name, from Vereeniging, says he too wanted to be medically circumcised because he was tired of being teased at school.
So ke re ba khotsi ba ka sekolong ba ntshe ba rekele jwafu ke nane ke peace.
He was impressed by promises from Viyelizizwe staff that they performed the procedure safely.
Ba itse hona ne ba katisang hampi so bona ba tlo re etsa safe. So a ka sente ke dumela ke nka consent form ga saena mabitsa rona ho mme a sebetsang hona mo.
On the 22nd of March, Tshepo underwent the surgery. His wound was stitched up and dressed with plaster and a bandage. For 2 days after the operation, he wasn't able to urinate. Puleng grew worried. She says the clinic didn't explain to Tshepo how he should care for his wound.
Information and what not. Ba mo file fela le box la dipanado. Sunday morning ke nkemetse a warm ke nkeletswa ile khof ke kenye tsubi ka maybe about 10 to 15 minutes ke zame hore ke nne ke tlose blast ha ke ntse ke tlosa o bana le di pain wall okay ke nne ke ncenge ke tlosa nyane ha ke tlo itlosa ke thola ga ba kenya di gauze ha ba kenya cotton ba beile fela plaster e mamarelang hodima di stitch tse fresh immediately ha ke qeta ho itlosa madi atswa madi a mangata jwalo moroto wa tswa so you can imagine hore ona sa khone passa urine from Friday ha tswa moroto o mong o motelele o sa khone ho thibeha.
In Vereeniging, Thabo was experiencing similar symptoms. His mother, Dineo Rafulatsane, says Thabo, who was also circumcised by Viyelizizwe Solutions, but at Johan Haynes Community Health Center, had bandage over his wound, but no plaster.
After 3 days, re inele na kwetele karametsi ya home a letswai then re be re ntsha bandage. Okay, it's a khutla. Bosibu na santsa complain. Are o botlhoko na ke ra man. O itse batla o se o circumcise ke mamella ntwe na vele botlhoko ke go bo stitches mo. A mama ke khone go rota. Ke ga go rota a sokola go rota and then ne go ile mo pele ntse bandeshitswe.
Meanwhile, in Bipatong, Tshepo had started developing a fever. Puleng sought medical help.
Casualty ba mo check ba what's going on here. No, he went for circumcision on Friday, so I don't know what's going on. Ba hospital ba nketsa referral letter ba phone ambulance there and there.
Tshepo was admitted to Sedibeng Hospital. Meanwhile, Dinewo was desperately trying to nurse a pain-ridden Thabo from home.
So kadula ka maybe ke di after effects kadula ka cleaner ka letswai leo bile ke cleaner 3 times ke cleaner bosibu ngwana alla ga ga go ba lapsiu ka phone ambulance ya fitla ba mo check ambulance ba ngola ntho tsa bona le bona ga ya go kopana hospital ha se ba mo admitile ho saying baba ba re o batle ya specialist se dilang ka bana kwa mola ba yo di specialist di ko Sebokeng.
Both Thabo and Tshepo were now patients at Sedibeng Hospital. The young boys were examined and treated by urologist Dr. Kalisto Sillo. He says he'd only been working at Sedibeng for a few months when he started seeing an alarming number of botched circumcisions. The age of the boys shocked him because he says it's more risky to perform the procedure on boys of their age.
A 10-year-old is not the most cooperative client you'll have. Especially once you've localized and they start seeing some bleeding, you are going to struggle with them. They are very difficult patients. I would say start at 14 at least as a minimum.
In this document, the National Guidelines for Medical Male Circumcision, or MMC, released in 2016, the Health Department says caution should be applied when doing MMC in the 10 to 14-year age group, as the risk of injury in this age group is high. But Chief Director for District Health Services in Gauteng, Macy Lerutla, seems to be unaware of her own department's policy.
Would a 10-year-old, for example, be encouraged to say, go have a medical male circumcision?
The earlier the better. Many parents take their children for circumcision way before they get to that age of 15 years.
Parents of young boys say their children are encouraged at school by Vigelizizwe recruiters to undergo the operation. Vigelizizwe director Dr. Mfundo Kuhlase denies his staff recruit at primary schools.
We are not allowed to campaign in primary schools. You must remember that this is an HIV prevention program. So it has to impact at the ages where there is a high level of sexual activity, if I may put it. So the program is targeted at a certain age group. 15 to 34 are the highly sexually active people, and that is where the highest new infections are found.
But Checkpoint's investigation has revealed boys as young as 10, like Tshepo, are being targeted by Dr. Kuhlase's recruiters advertising medical male circumcision at primary schools. He says he'll investigate why this has been happening.
It is possible that some things get through the cracks, but in the main, we have our rules as a company that the recruiters must abide by. But if some accusations or allegations are brought to our attention, it is prudent for us as a company to follow them up and take the necessary measures to prevent such from happening.
Puleng blames herself for Tshepo's botched surgery.
It's hurting as a parent, thinking I signed in that consent form or wana ayalo circumcise. Can't the results di tloba so.
Thabo is also full of regret. Puleng says Tshepo hasn't been the same since the traumatic ordeal.
affectile haholo because ona jalo ngwana ka kgone ho etsa next sometimes le dijo ha di je haeba o seng ngwana o santsa lla a tshaba fela hore re tlo mo clean haeba mantsi be o tshwantse re mo zame hore mo tshware hape re zame hore mo clean ngwana be right.
Coming up,
bana ba ka ba kena go motso ke utlwetse tswa sekolong sa go motso gore bana ba circumcise.
what is the Education Department saying about Vigelizizwe's alleged recruitment drive at primary schools?